that our very own CEO, Mike Powers, is part of the kitchen cabinet for California State Association. We are working for Ventura County to ensure that the governor and Dr. Galley and Ana Manasantos has the update information from Ventura County and how we can work together through the COVID-19, through the state tiers, and make sure that our community is healthy and that we also have our businesses healthy. So those are components that we are working on and want to make sure that our public knows that as well. Today you'll be hearing more information in regards to Ventura County, our support services in regards to housing and food for our most vulnerable, our homeless and seniors. You'll hear about our farm worker resources program, some more information on that, and also our amazing hospital system. So with that, I will introduce Rigo Vargas, our Director of Public Health, but afterwards will be Victoria Jump, Director of messing that one up. It's been a long couple days of board meetings. Ventura County Area Agency of Aging, Tara Kuruth, the Program Manager for Ventura County Continuum of Care. Then we have Israel Vasquez-Nicolas, our Program Administrator for the Farm Worker Resource Program. Amy Towner, our CEO, Healthcare Foundation for Ventura County. And then to close with Mike Powers, our CEO. And then also I would like you to tune in. Next Tuesday we have a board meeting, so you can go to ventura.org/BOS. And then we will also be having Mike Powers, our CEO, doing some presentations on the state of Ventura County. I think if everyone could tune on to those, that'd be great. So thank you, be safe, practice good social distancing, and we will now get more information on our public health and the rules and regulations associated with COVID-19 and even new information from today. So thank you very much, everyone, and now will be Rigo Vargas.
Good Wednesday afternoon, Ventura County. Rigo Vargas, your Ventura County Public Health Director, here with a brief update. As usual, I'll give you an indication of today's numbers, touch upon the tier metrics, and then say a few words regarding gatherings and specifically around Halloween. First, with regard to today's numbers, we're reporting 149 newly positive cases in Ventura County. So while this number is a little bit higher than what we would like to see, especially in contrast to yesterday's number that was so good to see of 10 new cases, today's number is of some concern, but our epidemiologists that follow this information even closer than I do assure me that not only is this a reminder of the variability and flexibility of the numbers based on testing and when the numbers actually get reported to us, but also we're still trending in a good positive direction. In fact, if today the state was to report the previous 7-day average, we would be under the 7 new case per 100,000 resident metric. So again, right now though, talking about metrics, and perhaps this is a time for us to show the slide that we've been showing to you in the last few meetings. We are, with the new numbers that the state released on Tuesday, we are over the one key metric, the case rate, that we've been over for a while now. And I want to touch upon that a little bit further. Again, I just said that we are still trending in the right direction, and our case rate would actually be under 7 if we were to report it today. The state does report this number on a weekly basis in its 7-day average case rate per 100,000 resident, and that average has a 7-day delay. And so based on that, the number that you see here of 7.9, that is an adjusted case rate that the state has for us, and it is based on those numbers ending the week of September 5th. And that week of September 5th is very important because our one of our larger outbreaks that we've had occurred during that week. And in fact, that contributed to us not meeting the goal of being under 7 daily case rate average. Was because of that outbreak. Of course, that wasn't the only cases that occurred during the week. The usual person-to-person and the usual community transmission cases occurred during that week, but coupled with the jail inmate cases that week, that put us over what we were trending to be within 7, but it put us at 7.9. Again, please, Ventura County, don't be discouraged. There will be outbreaks. We'll contain them in partnership, in this case, with strong leadership at the Sheriff's Department. We feel this outbreak is contained, and so there will be outbreaks, and we'll deal with them as soon as we can with mitigating the circumstances. And while we didn't move towards the red tier 2, which is in a positive direction, I am very confident that soon we will. And again, even with today's number of 149, it's an average. The 149 new cases covers a variety of weeks and days, so one number shouldn't concern us too much. So that's with regard to new cases. And by the way, before I leave this slide, let me just also remind all Ventura County residents that your efforts do matter and that you are making a difference. There you'll see 5 out of the 6 original metrics we are fully meeting. In fact, we are doing so very well that if the state was to use primarily the testing positivity rate, we right now we're at 4.4. If the state was to use this as a sole indicator to be able to move between and across tiers, we would be in tier 3. We're doing so well with that important metric. So our positivity rate is excellent. So is our average daily test over the last 7 days. That varies as well. We were at 240 yesterday in terms of our average. Today we're at 200, but even then we're still significantly over the 150 goal that the state has set out for us. The other numbers regarding the hospital bed availability, the ventilators, and the number of residents that are in the hospital, all are also trending really well. So please, Ventura County, continue to do the excellent work that you've been doing with all the recommendations that we've had. I know, 6 months plus is so hard on everyone, but we got to continue doing what we've been doing because it will pay off soon where we're going to be moving into a new tier. The other numbers that we're going to be reporting is with regard to hospitalizations, also on a very positive trend, is 42 people that are in the hospital. That is among the lowest numbers that we've had in weeks. And that, again, I think is an indication of the situation in Ventura County where we're trending in the right direction. Within those 42 cases of individuals that are in our area hospitals getting excellent care, there's 6 of them that are in serious condition and they are in the ICU unit. And so we hope that those will recover soon. That number is also a very good number. We've not been in single digits with regard to ICU in, I think, months. In fact, our average the last week or so has been around 11, but this is the first time that we've been under the 10 mark. So good numbers there. Finally, and with regard to today's numbers, it is, while I've painted an optimistic picture here of our trend and our numbers, death cases do continue to climb. Today we're reporting 3 additional deaths of Ventura County residents. These individuals were in their 50s and 60s. They did have comorbidities, so continues that pattern that are in our county. The majority had comorbidities, but as a reminder, COVID is still a very serious health condition, and it affects especially those that are have underlying health conditions and are especially prone to not only get infected, but also to have the ultimate serious consequence of being COVID positive, which is death. And so very unfortunate that those families, 3 additional families have joined now an unfortunate group of 141 families that have lost a loved one in Ventura County in part due to COVID infection. Actually, the one last number, I did just also get an update on the newly tested number. That number today is 1,125. 1,125. That brings our total tested to almost 171,000. Precisely, our count is 170,911 Ventura County residents that have now been tested. As a total, by the way, with the 149 new cases today, our total is just shy of 12,000 positive residents. 11,842 Ventura County residents are now positive with COVID, with those new numbers of 149. Wanted to touch as a final point here, in terms of gatherings, specifically Halloween. So, Dr. Levin shared some information yesterday around gathering for Halloween. It's such an important holiday for our children. They've been going through a lot, just like everyone else, especially our business owners and employees and staff. Everyone has been greatly affected by COVID, and children in particular. And so we understand the interest in having some activities for children. And while we're 6 weeks away from Halloween, we did come up with the guidelines that Dr. Levin shared yesterday. We've modified them in part to be fully aligned with a few other counties that have issued guidance on this topic, and also because we've heard from many of you residents and concerned parents, and we want to do this in a safe manner. And so there's new updated guidelines posted on Ventura County Recovers, our website. They're interim Halloween guidance, and we call it interim for 2 reasons. One, because as I just said, we're 6 weeks away from Halloween, and so there's time for, especially if we continue to do well in our metrics, for some adjustment into this guidance. The other reason why it's interim is because the state, we just learned earlier this week, the state is expected to come up with their own guidance that will, of course, cover the whole state, statewide guidance on Halloween gatherings and other recommendations and guidance. So we will expect to be reviewing that closely as soon as it comes out, and really also to be in alignment with the state. And so for that reason as well, we are issuing this today's updated guidance as an interim basis until the state comes up with their own statewide guidance. I urge every parent, every individual that's very interested in this topic to go again to our website and review the specifics around the guidance. And again, visit www.venturacountyrrecovers.org for a copy of such guidance. And again, it is, we're reviewing things closely, like we are all related to metrics, to safety, and things can change, but for right now, that is our guidance. So with that, I conclude my remarks. I'd like to now turn it over to our Area Agency on Aging Director, Victoria Jump, to come on up as soon as I wipe down the podium.
Thank you, Rigo, and good afternoon. My name is Victoria Jump, as Rigo said, and I'm the director of the Area Agency on Aging. We're the county agency tasked with providing services to older adults and people with disabilities with the goal of keeping people safe at home. The services offered through our office have become even more critical as we continue to combat COVID-19. When the public health emergency was announced in March, the county immediately identified the needs of the nearly 200,000 older adults in Ventura County, as well as those living with disabilities. Amongst the most vital of those needs has been securing food resources and meal services. Since March, the Area Agency on Aging's Senior Nutrition Program has served more than 1.8 million meals to over 20,000 people. We have received 47,000 requests for services, have made over 123,000 food and meal deliveries. This has been made possible through countless community and county partnerships and donors. Our team of staff Our disaster service workers and volunteers have worked tirelessly to do everything from serving in our call center to packing food boxes, delivering meals, and conducting porch visits to assess the overall well-being of some of our most vulnerable clients, including those with life-sustaining medical equipment and those living with Alzheimer's disease or other related dementias. In addition to meal services, the VCAA's Health Insurance Counseling and Advocacy Program, or HICAP, as it's more commonly known, is preparing for Medicare open enrollment. Open enrollment for Medicare this year is October 15th through December the 7th. Our highly trained team of HICAP counselors are ready to help our Ventura County residents navigate Medicare open enrollment and determine other benefits for which individuals might qualify. Normally, we hold 100 and plus events at senior centers throughout the county to assist people with the process and choosing a plan. But due to COVID, most counseling appointments this year will be held via telephone or online video conference, with in-person requests being handled on a case-by-case basis. For more information, visit our website at www.vcaa.org or call 805-477-7310. We receive many calls from the community asking for ways to help, and we are now coming to Ventura County with a way to help from the comfort and the safety of your own home. The VCAA has launched a Letters of Support campaign in partnership with Meals on Wheels America. This campaign is designed to provide older adults and people with disabilities living in Ventura County with letters or cards and a message of encouragement and support. 30% of Ventura County's older adults are living alone, and the isolation, loneliness, and depression many of them are experiencing during this crisis has become as much of a threat to the overall health as the virus itself. With the holiday season quickly approaching, we know that this is the most critical time to extend not only our services to these populations, but also our care and our support. We ask that the community come together to send letters to our agency. Our address is 646 County Square Drive, Suite 100, Ventura, California, 93003. Please notate Letters of Support campaign on the envelope. All letters will be reviewed and then delivered with the food boxes and meals from our pantry. We continue to encourage family members and neighbors to safely connect with their loved ones who may benefit from similar letters of encouragement and support from grocery shopping or other errands as well. It's extremely important to keep open lines of communication to help minimize the isolation so many Ventura County residents are experiencing. The Area Agency on Aging remains committed to ensuring that the populations that we serve remain safe at home. We recognize that the people we serve are amongst those most affected by the crisis, and we are working to help provide the means for them to sustain a higher quality of life, even during this difficult time. Please reach out to us for more information about the services that we offer. Our website again is www.vcaa.org, and our phone number is 805-477-7300. Next up is Tara Caruth, who is our program manager for the Ventura County Continuum of Care.
Masks and earrings. Good afternoon. I'm Tara Caruth, and I'm the program manager for the Ventura County Continuum of Care. We're a group of agencies throughout the county with a goal of preventing and ending homelessness. I want to start by thanking all of our partners, our nonprofit providers, our county service providers, our city partners, the faith community, and our state and federal funding partners who have made providing essential services possible during this time of the pandemic. We are providing non-congregate shelter or motel vouchers to 130 seniors and persons with high-risk health conditions to keep them safe and well from COVID-19. We are also working with our emergency shelter and transitional housing providers to provide shelter and support for 500 persons throughout the county. All of our emergency shelter and transitional housing programs are following the guidance from the Centers for Disease Control and California and local public health guidance for safe operations. This includes screening all residents and staff for symptoms of COVID-19, requiring that persons in shelters wear masks, and taking regular temperature checks, as well as spacing beds at 6 feet apart and offering meal services with safe social distancing. Additionally, outreach through our county healthcare agency, including our backpack medicine and one-stop programs, have served 1,200 persons with 16,000 instances of services, including healthcare services, hygiene, and referrals to community-based organizations, including shelter and housing programs. Our veteran population continues to be supported by our county-wide veteran service providers with transitional housing and motel placements. Through this effort, our partners have housed 17 veteran households in this year, and the United Way's Landlord Engagement Program continues to work to recruit landlords that will accept VASH vouchers, which are housing vouchers for veterans, and other rental assistance to find permanent housing for veterans. The county and the city of Oxnard are working in partnership with Mercy House and community development partners to access the state's Project Home Key funding. Project Home Key is a transition from what was known as Project Room Key, which was non-congregate shelter in motels, to allow us to access funding to purchase and convert motels into permanent housing. We are pursuing the acquisition or purchase and conversion of the Oxnard Vagabond Motel into 70 units of permanent supportive housing. This effort is supported by $9.5 million in state home key funding and $3.5 million of county coronavirus relief funds. The property will be utilized as non-congregate shelter for an interim period of 12 to 18 months before it will be converted into permanent housing. The conversion requires adding kitchenettes and other things that would make a unit safe for permanent housing. The city is currently supporting the project and working to engage the community and the neighborhood for support of the project. Through the interim operations and permanent conversion, this effort will help transition more than 70 individuals to a permanent home. Through all of our county-wide efforts, all of our partners that participate in the continuum of care, there have been 322 persons assisted with permanent housing placement since the beginning of the pandemic. If you are in need of housing assistance, whether that's homeless prevention or assistance in finding permanent housing, please contact 211 by phone to be connected to one of our service agencies. You can also find out more information about the continuum of care, resources, and ways to get involved by visiting our website, www.venturacoc.org. I will next introduce Israel Vasquez Nicholas, the Program Administrator from the Farm Worker Resource Program.
Hello, my name is Israel Vasquez with the Ventura County Farm Worker Resource Program, and I'm very excited to talk about all the work that our program has been doing to help our farm worker and our agricultural community. And one of them has been through our newest program, which is called Cultivating Health in Agriculture, which is with the support of the Ventura County Medical Center. With the help of the Ventura Medical Center, we are able to go to the agriculture fields and talk to our farm workers. And what we do is basically talk to them about COVID-19 information, new testing site, how to protect itself, best practices, and we also provide them with the kit, full information about resources available to them in Ventura County, and a disposable face mask for them to use. And farm workers are able to ask any question regarding COVID-19 or anything that they might need to with the doctor. And this has been very helpful because at times the farm worker they start engaging with the doctors, just asking any question that they really been wanting to ask and not have the opportunity to ask. Also on September 1st, we started assisting with the new program by answering questions, completing application for this program that is called the Farm Worker Household Assistance Program. So this program is intended to help farm workers who reside in Ventura County who are facing economic difficulty, are low income, and need help to meet their basic needs. So this program will provide our farm worker with a grant of $1,500 per eligible family. The application is available online at www.bchsa.org/FHAP. Oh, and the application will be accepted till September 30th at 11:59 p.m. Or if there are farm workers who face language barrier, have difficulty completing the application, they can call our Farm Worker Resource Program, our 805-385-1899. Also, we understand that language accessibility can be a huge barrier for farm workers to seek assistance, and that's why I'm extremely excited to announce that we have added one additional trilingual staff to our program. This individual not only speaks Spanish, English, but also speaks Zapoteco. We understand our program is able to assist our farm workers in our agriculture community in English, Spanish, 4 different variants of Mixteco, and now Zapoteco from the community of San Jose La Chiguiri. And we also continue to seek additional ways to help our farm worker linguistically and culturally. And now I would like to introduce Amy Towner, CEO of the Healthcare Foundation for Ventura County. Thank you.
Thank you, Israel. I appreciate that. Hi, I'm Amy Towner, CEO of Healthcare Foundation for Ventura County, your foundation that supports your Ventura County Healthcare Agency to enhance and augment it. So today I have exciting news for you all. We have broken ground at Ventura County Medical Center because it's been chosen as the third family room concept in the state of California. The family room concept, just for those of you that aren't familiar with Ronald McDonald Family Room, it's a place that's like a home away from home inside the hospital where families can grab a snack, they can relax, they can get some work done, maybe get a few hours of sleep. There's a family room space, and then there's a quiet room space. So if you want to enjoy the family room, you can be there and enjoy, or if you have a child that wanted to lay down, you could go into the quiet space and lay down. There's a kitchen area, shower facilities, rest areas, laundry facilities, internet access, living room, and a play area as well. So I want to back up a second, and I want to paint the picture kind of in 3D and color for you, because Ventura County Medical Center actually was chosen because of the robust pediatric inpatient and specialty care that our system has and our county has. Our Board of Supervisors and leadership has been committed to delivering high quality care close to home, and especially for pediatrics. So Ventura County Medical Center is actually the licensed inpatient acute care hospital on the west side. It also was Ventura County's first NICU, probably over 40 years ago. It's also home to a pediatric intensive care unit, which is a beautiful complement, especially because we're caring for some of the most sick children, and also because we're the home to the pediatric trauma center, or we have a trauma center, and it includes pediatric services. In addition, we also have pediatric services at our ambulatory care sites. We have a children's center for cancer and blood diseases. Most counties don't have this. We are extremely lucky in Ventura County that our leadership is committed to this level of service. It also is the home to the Pediatric Diagnostic Center, and which encapsulates a lot of specialty physicians and service lines that other counties and areas don't have. We're lucky that we just recruited Dr. Robin Evans, who's a new pediatric surgeon, and so he will also be a fantastic addition to this. So another great, actually, a wonderful point that just came up in a recent award has been that Ventura County Medical Center was awarded the $15 million Prop 4 money. And what this money is going to do is it's going to revamp some of the second floor Feiner buildings so that pediatrics can move into that space. Why that's special is because it's just steps away from this Ronald McDonald Family Room, and also another unique part of this hospital is that all of the women's and children's are located on one floor inside the hospital. So all of the second floor is all women and children. Very unique for a hospital to have this. And this is that good planning from our hospital and county leadership. So Ronald McDonald House Charities Global voted unanimously to establish this third family room concept at Ventura County Medical Center because of this robust and dedication that our county has, but also because of all of you. They saw our spirit. They saw our heart over the last 3 years when we have endured fires and tragedies. It's just been tragedy after tragedy, and they have watched us. They have also watched actually many organizations like National Charity League Juniors. They have been a phenomenal partner from the very beginning. And our Rotary Clubs. Our Rotary Clubs all came together and formed a collaborative to be able to support this Ronald McDonald Family Room so that families could stay close and families could be with their children and families could access this high quality care. So because of that, the construction costs were going to be $1.2 million. Ronald McDonald House Charities of Southern California, the chapter, said because of Ventura County spirit, we're willing to front that money to make sure that that family room gets built, even amidst COVID. So to date, we've been able to raise $950,000 to date, and we are closing in on that gap with the help of the community and people just like you. So a couple really first and onlys. We're the only family room project actually in a public hospital system. And we're one of the only family rooms to have a separate family room and quiet room space, which is really unique. A lot of times those spaces are together, and you can imagine how hard that can be putting a little one down for a nap when the family room is going on with the television. The other really wonderful aspect is that we're one of the largest family rooms on the globe. This is super important during COVID-19. That means we have extra space where we're going to be able to serve more families. So this is a wonderful aspect, and it's been great that the Building 305 building has been able to dedicate that kind of space to support. So the Ronald McDonald Family Room is really a place where we can show our county community support to them whose children are fighting life-threatening illnesses and diseases, and at some of their most difficult times. One of the ways that we can do this, and I want you to mark your calendars for the first week in April every year. Every year we will have a walk for kids. And the Walk for Kids will actually, the proceeds will go to support the ongoing sustainability of this program. So the website, just in case you need more information, is rmhsc.org/Ventura Family Room, where you can get more information about the family room. And so yes, the first week and the first Sunday in April, every April is when that will be. And our walk is held at the state beaches here in Ventura. So the family room construction is underway and scheduled to be completed by the end of 2020. And if you do want more information, you can always call me, Amy Towner, at 805-652-3361. If you would like more information, also my email address is amy, amy.towner, TOWNER, @ventura.org, in case you want to email me for more information as well. So this family room is really a place of respite. It's an exciting time for our community, and it's a place where families can be together, they can be close, and they can receive the care that they need. But I think more important is that this family room really helps treat families where medicines and treatments don't work. It allows our families to help one another and be close together so that we can heal. And this is another commitment to the psychosocial, emotional, and the whole person care that our county is dedicated to for its people. So I want to thank you again for the time, and I have the distinct honor and pleasure of introducing next Mike Powers, our County Executive Officer.
Well, good afternoon, and thank you, Amy. And what wonderful programs we've heard about this afternoon. You know, Ronald McDonald House, I have a sense of a number of reasons why they selected VCMC in our county, which is a real validation of our system. And I think it's partly the broad, robust pediatric programs VCMC has and the quality of those programs. I think it's because Amy was absolutely relentless in her pursuit of the Ronald McDonald House. But it was also the community support where we'd be at events for the Junior Charities League, and that when there was an opportunity for the community to support Ronald McDonald House and let them know whether or not we wanted it here, the room just erupted. And you could see on the faces of the leadership there, they thought, this community wants and needs this family room. So it's wonderful to hear about that. And all of these wonderful programs for people in need in our community, seniors, farm workers, the homeless. And so great to hear all those programs. And in terms of homeless, you heard Tara say 322 formerly homeless folks housed since the beginning of the pandemic. Just amazing work of the county and community partners coming together, even during this incredibly challenging time. And during this time, too, we've heard Mr. Vargas talk about the numbers, the good direction the numbers are heading in, which is a great tribute to the work that you're all doing. We do continue to engage with the state with their new tier system. The system makes sense, but how you move through them, we were asking for some more flexibility. As I think we've mentioned before, because of our high testing volume, because of our excellent positivity rate, a rate of 4.4% that would actually move us 2 tiers ahead, from purple to red to orange, and because of our very favorable and low hospitalization rates that are happening. And lastly, because of our excellent business compliance rate based on the state's own strike teams, we're at 99.9%. So we will continue to advocate. As we know, many of you are asking those questions. We are asking those same questions of the state. The state have been good partners, and they've listened and engaged to us, but we will continue to press that position with the state, because we know we can move forward safely here in Ventura County because of you and because of our businesses. Last thing I'd say is we've heard so much about, and we see it every few minutes on the news because of the incredible fires that are happening up and down the state, and it's such a tragedy to see that happen. Our community obviously is no stranger to that, and we've felt it, but we've also felt the benefit of the mutual aid that we get when that happens, of counties and cities from across the state and the nation really sending firefighters to help us out when we've had the Thomas and Hill and Woolsey fires here. So that's happening right now with our firefighters going to help on these other fires across the state, and just wanted you to know that that is happening, and that helps our state, it helps our community, and we so appreciate them doing it. I was speaking to our fire chief this morning, and he said that there are 82 county firefighters on the lines in these other fires around the state. So just keep them in your thoughts and prayers, because they're out there protecting everyone in our community. So with that, I would just say thank you again, Ventura County. We're heading in a good direction because of you, and stay safe and stay connected. Take care.